We're all so busy living our lives. And then suddenly something cuts through that, something often very unexpected.
Paediatric trauma call, 15 minutes.
A 71-year-old female with 2 stab wounds to the back.
He was found to be in traumatic cardiac arrest.
I can't feel any pulses. We're at St George's Hospital in Tooting.
Yeah, 24 hours, 7 days a week. I love that question. What's your opening hours?
St George's, London. One of Britain's busiest A&E departments, under more pressure than ever.
So do you want to watch, darling, or do you want to look away?
This is the worst day ever. You never know what's coming in, and you just have to be ready for anything.
Gas canisters exploded, 15% burns to hands, face.
In a world of uncertainty, we see a life-changing event.
I'm ANAP, I need her to get out of here, please.
When patients come in, something takes over.
I'll be fine. I'm going to be very fine.
A place where life,
Give me an A. Give me an E.
love,
Okay, good lad. Well done.
and loss unfold every single day.
Did you enjoy the Queen's birthday yesterday?
I watched the football.
All the patients you're about to see were treated in just one 24-hour period.
Don't worry.
We get to see people who love one another in loads of different ways. Yes. And I think you can give someone the best care in the world, but really what they want is to hold the hand of the person that they love and for them to tell them that they're going to be okay.
You're my hero.
Share? Go on. I want to share as well. Would you like to share, Hannah? Yeah. What? That's so nice. You don't need that much. Christ. I love the smell of it.
Right, gentlemen, ladies. Fantastic. One by one now.
In charge of the emergency department today is consultant Rathan.
Being on the floor in these purple scrubs, it is a huge responsibility. Not only from the patient point of view, but also from the trainee doctors that you have to supervise. Do you want to go around and give them a hand in peds? Is that all right? You happy with that, yeah? Gosh, you look at that, they're still like shock. All right. They're like, oh, no, oh my God, I'm never coming back here again. Guess what? You're in peds as well. I thoroughly enjoy mentoring and teaching. It's one of my favorite things is to be able to teach. You do this, all right? And I used to basically use that and a left urge.
Oh, with your shoulder?
Yeah, it's the whole thing, the shoulder and the whole thing. It's a privilege to be able to support them, help them, and facilitate their learning. The key lesson, first and foremost, is that don't take anything for granted. That's the whole point of managing trauma, is that you expect the unexpected. Do you mind? I need a phone.
I'm on it.
Rathan, chill out. No wonder your blood pressure's through the roof.
I'm actually very chilled.
Hello, St George's ED. Okay, go ahead.
A lorry driver is being rushed to A&E after a fall at work.
52-year-old male, fallen 6 foot backwards off a ramp. Thank you. Bye. Adult male, trauma call, 10 minutes.
The ramps on the back of lorries, they can be quite high. This is a head hitting a ground from a height of 10, 12 feet. And you're falling onto hard tarmac or hard pavement. That's a hard fall. ETA?
10.
Could be anything from a nasty head injury, broken skull, a bleed in the brain, on the brain, neck injury, so the spine and the neck could be broken. So we expect the worst.
is 52 years old. He was on a ramp. He is a delivery guy on a ramp about 5 to 6 feet up. I have a picture, I'll show you later. And he's actually tripped and fallen backwards onto the concrete floor. Top to toe injuries are C-spine pain, predominantly C2, C3, with associated left hand numbness.
Neil, just popping some monitoring on, okay?
Hello, sir. What's your name?
Neil.
How old are you?
52.
52. Just because someone can talk does not mean that there's no danger. Well, what's happening? Oh, yeah, but don't roll him. He could have a really nasty break to the spine and the neck that could paralyze him. And any damage to the brain could be not just life-changing, it could be life-threatening. Neil, I'm going to quickly examine you. You just have to lie there. Pupil equal reacted light, about 3 millimeters.
Neil, I'm Laura. I'm one of the doctors here. Does somebody know that you're here? Who's your next of kin? Okay.
I don't want to bother it just yet.
Okay. We'll see how we get on. Okay.
I live about 200 miles away.
Do you? Where do you live?
In Middlesbrough.
Oh.
He didn't tell me about the accident at the time. I would say it was typical of him not to want to worry me, and I think he would not want to give that kind of news over the phone.
We need to just keep you lying flat like this until we get you in for a CT scan to check what damage you've done.
Neil keeps things close to his heart, and you often don't know what's going on in there. He'll keep quiet and he'll try not to worry you.
Well, we'll figure out what injuries you've done once we get the scan results.
It's the first time that something really bad's happened to him, which it's hard to take. It made me realise that you do take your parents for granted, because they're just there all the time, but then you don't think about losing them, do you?
It's a little bit fresh in here.
Father of two, Neil, is in resus after falling headfirst onto concrete. Doctors have ordered emergency CT scans to assess possible injuries to his head, neck and spine.
Ready, steady, slide.
His family are 200 miles away in Middlesbrough.
Right, so my name's Sean, I'm one of the radiographers. So we're just going to do this CT scan of your head and neck.
But when I first met Neil, he was working behind the bar in a pub I used to go into a lot. Yeah, I did fancy him straight away, yeah. He had more hair then. He was really interesting, he was really fun. If nobody would get up and sing the karaoke, he would. And he'd get up, stone cold sober, and go on the karaoke. And ABBA, he would absolutely love. He'd know every ABBA song.
Breathe in and hold your breath.
He's been driving lorries for about 18 years, working away a lot. So quite often when the children were really young, he'd be working 7 days a week. But it was a secure job that helped to raise a family. Neil absolutely loves his children. I think they mean the world to him. I think Neil did find it hard not being there, working away a lot, and felt he was missing out. When Lauren was born, he'd gone away to Ireland that week, and I rang him on the morning to say I'd gone into labour. So he starts hoofing it back from Ireland, gets on the ferry. So I went into hospital, had the baby, came home at tea time, and he'd just arrived home, and I kind of walked in and plonked her down and said, "There's your new daughter."
He's definitely a proud dad. He'd always take me to football, every training session. Saturday, Sunday, he'd always come down and watch me. So obviously you're excited when you see him on the weekend, on a Thursday, Friday night.
we gradually drifted apart. Neil and I are not together anymore. We were together for over 20 years and we've got 2 children we both love. We've got a lot of history together. You can never turn your back on that. You can't work away. You might have your differences and decide that you're not going to be together anymore. But I couldn't turn my back on someone and not support them. I wouldn't do that. I couldn't. It's just not in me.
He's got something. That doesn't look. That looks like a tumor.
So you know the covering of the brain. That normally be straight. Yeah, and you'd have that line going straight across. It looks like a meningioma. Which is? It's a tumour. Is he known to have them? Is it new?
No, he doesn't know anything like that.
Oh dear.
So this is like fracture the end of your bone, and I will be ready to go for a full cast.
A full cast?
Yes, I hope so. You can choose your own color. Unfortunately, you're gonna have a trouble. Do you have exams coming up?
No, I've done my exams.
You've done. Very lucky.
Ready, steady, go.
Is that him?
Get off.
Found him.
Right page.
Get off.
Got him.
Would it be possible at some point to get some IV paracetamol or morphine?
Yeah, you can't have any more paracetamol because you just had there was paracetamol in that. But I'll speak to Sarah and we'll see what.
I don't want to kick up a fuss, but I'm just.
Okay, no, that's fine, darling.
28-year-old Ben has arrived in A&E after being involved in a road traffic collision while cycling to work. Doctors have carried out emergency x-rays to assess his injuries.
Hello, my name's Sarah, one of the A&E consultants here. What actually happened?
I was on my bike, the car in front of me just came in without indicating or any warning or anything, so I couldn't stop. I went into his car, but then ricocheted off that into the pavement, and most of the impact was on the pavement on the shoulder.
Ben's girlfriend Karen has travelled to St George's from her home in North London.
His voice sounded hugely different when I answered the phone. I could tell he was really shaken, and to hear him scared me too. Right here, okay? We'd been together just about a year. I love you very much. And I think this was our first time ever in our relationship that things had been a bit scary and a bit harrowing. That was our first test. I'd been single for quite a few months before I met Ben. And I wasn't really expected to meet anyone when we did meet, and I thought, oh, it's quite nice.
Okay, here we go. Sharp sting.
And it happened quite quickly. It felt like a whirlwind romance. I just wasn't expecting to find someone that I would end up in such a wonderful relationship with.
Consultant Sarah has received the results of Ben's x-ray.
It looks like it's dislocated. It should be here, shouldn't it? So no other injuries by the look of it. Didn't hit his head.
Your x-ray looks like you've dislocated the shoulder. So what we need to do is give you some sedation so that we can pull your shoulder back into position.
That's 800 ibuprofen.
Don't need to call you one.
Maybe my mum. I don't know if you call my mum. Her name's Mandy.
What she says is she needs to come down. She'll
No,
come
tell
down.
her.
Ben? Does she know about me? Okay. The boyfriend's mom is always a significant point in any girl's relationship calendar.
Hi, Mandy. Hi. Hi, it's Karen here, Ben's girlfriend. I'm so sorry to call you out of the blue. Yeah.
It was a responsibility. I didn't really want to mess up.
Ben's asked me to give you a call because he's actually been taken to A&E today. He's fine. He's dislocated his left shoulder. They're just putting it back in at the moment.
Okay, so this stuff will make you feel quite sleepy now. Okay.
I might just like gently taking your arm out of the sling. There you go. Hold on to it for you. Yeah, you're doing well.
Okay, so he's just going to have another 20.
How are you feeling?
You're nice and relaxed now. Just try and go with it.
Up on your eyes for me.
Can you provide counter traction? Just take that and that.
Okay.
There we are.
Yeah, good. All right, perfect. Well done.
Doctors will need to carry out additional x-rays to establish whether there is any further damage to Ben's shoulder.
Nice deep breaths.
Hello. Up on your eyes for me.
Georgia, second help? Medical or trauma?
Yeah. An open ankle fracture.
A 73-year-old woman is being rushed to St George's after a fall in her bedroom at home.
When an elderly patient's fallen and you hear that they've sustained an open ankle fracture, the first thing that you think about is how much pain is that patient in.
Female trauma call, 15 minutes.
Secondly, the other thing is going to be about, is that foot going to be salvageable, because it could be hanging off. When you have such a call coming in, the trauma team involves an orthopedic surgeon. He's going to be very, very important.
So what's the story here?
Wendy lives alone. She got up to go to the toilet.
Yeah.
Tripped as she was getting up, landed on a carpet floor. Open fracture to her right ankle. She's been crawling around the house for 2 hours to open the front door and everything. Pain 8 out of 10. So we gave her...
Sorry. Just relax it down.
Try and pop this arm down straight for us.
Getting ridiculous. She's not married.
Next of kin is neighbour.
No kids. Hello, Wendy. How are you? I'm one of the orthopedic doctors.
You what?
I'm one of the orthopedic doctors. I'm Meshan. I'm just going to have a quick look, okay? I'm just going to take this out and have a quick look. Okay, we're going to open the splint up a bit, okay?
If you have an open ankle fracture and the bone is exposed to the outside world, the chance of infection entering that area is very, very high.
Sorry, Wendy. Just taking the dressing off.
That infection could spread into the bone, needing that part of the limb to be amputated.
Quite a nasty break.
And you want to get the right antibiotics in early to start treating any potential infection that's got in before it actually takes hold.
Can we get x-rays urgently done, yeah? So we can do a little manipulation before we put it into a cast.
Chop her off. She's done with it.
You need it.
Do you like doctors?
Nope. Don't like the medical profession. At all.
You don't trust them?
Nope.
Do you normally walk around, you manage to get out of the house?
I like who I like. Who I don't like, I ignore. That's me. Call a spade, not a shovel. This leg is virtually useless.
Why is that?
I don't know. I don't suffer fools gladly, I'm afraid. I just do like to be left alone.
Do you have any allergies, Wendy?
No. Only hospitals.
Hospitals. Lovely. Thank you. We're going to X-ray, so they're going to take a picture of your leg, all right?
I just don't understand how I'm ever going to be rich.
Is that a goal then?
Well, yeah, like I'm lone, like I'm miserable and alone. I might as well be rich.
Makes me sick. It makes my heart beat to 46.
Do you want to see this CT scan?
Father of two Neil is in resus after a fall from height.
No injuries on the first survey.
Doctors have received his initial CT scan, revealing a potentially life-threatening brain tumour.
Oh. Wow.
Can you see it?
Yeah. It's new, isn't it?
It's a tumour meningioma, they think. Incidental finding.
You say tumour, it's bad enough. You said brain tumour, it's catastrophic. For most people, tumour means it is inoperative. It's not something that you can cure.
He doesn't know about it. What shall I say to him?
It is very rare to find incidental finding that could be life-threatening for the patient. But when it does happen, it's a huge heart sink feeling that, you know, you really, really don't want to have.
Neil, hello. The neck looks fine on the CT scan. Nothing broken, okay? So basically, at the moment, it doesn't look like you've got injured anything significantly. So that's good, okay. But on the scan of your head, okay, we found something that we weren't expecting, okay. So there's a lump there that looks like it might be some sort of tumour, okay, in your head, all right?
All right.
Sorry to have to kind of...
Knocks you a bit sideways, you know, when you get information like that. I comprehended it. And the taking in bit is the hard bit. It's literally a statement that you think there and then. This is life-changing. This is a life-changing moment. Well, at first you think, why me? You think of family. I have a young family. You know, you worry for them. You know, how are they going to deal with it? It's the unknown, the fate of the unknown, maybe. You know, it's all it can be.
You'll become doctor specialized in pediatrics, eh? You don't want to specialize in pediatrics?
I don't want to be doctor and dog.
If it's in your destiny, you won't be able to help it.
I don't want to be a doctor and master.
Okay, what are you going to be here?
I don't know.
An architect, a gymnast, an optician. Right, okay, what about a bodybuilder?
Does your shoulder feel better, sweetheart?
No.
No?
Yeah, it does. Should we
Have
get...
they done anything to it?
Yeah, they put it back in place.
Did they?
Yeah.
I was completely fucking out.
Yeah, you were.
It's been an hour since 28-year-old Ben arrived in resus after a cycling accident. Doctors have relocated his shoulder.
Take care of you. I'm not lifting a finger for the next few days, okay? You need to wipe your own arse. Okay.
Oh, shut up.
I didn't hear that, whatever it was. Don't worry.
No, yeah, that hurts.
He loves being looked after. He always wants to be cuddled and held and stroked. He just likes to be preened and pampered and swaddled. He's an unusual boy. A few months ago, we'd made plans to see each other, and I think he was coming over and we're just having dinner in and watching a film because I was so tired. I remember making a bit of a throwaway comment like, oh, I could really go a face mask, or like, and he was like, let's do it. And then about 10 minutes later, we were both sitting with face masks on watching a film, and I just thought, this is really nice. This is quite special. A little bit better than before now it's in place.
Right now, no.
No.
What am I doing next for pain relief?
Is it hurting again?
It's really settling back in again. Yeah.
All right, darling, let me speak to one of the docs, okay? Is it normal for it to still hurt that much?
Normally, when they put it back in, like, it's still painful, but it's like achy painful, not, oh my God, it's...
Yeah.
In the past, I had quite difficult relationships. Yeah, lots of fighting. My parents divorced when I was quite young. I was 9 years old. And not only that, but they went from us being in a family to them, they really hated each other. I guess that can put quite a skew on your perception of love.
Sorry, I wish I could feel it for you.
So maybe that's what caught me off guard with Karen, is that just how easy and carefree you could be with it while still being yourself. So when you have someone like Karen in your life, it really means a lot.
Guy's asking for some more pain relief. The shoulder guy says his pain's really setting in again. It's like 9, 10 out of 10.
He can have his repeat x-ray now, can't he?
Oh!
With Ben's pain increasing, doctors are concerned he may have further damage to his shoulder and are sending him for additional x-rays.
Dentist.
No.
A lawyer.
No.
A teacher.
No.
A vet.
No.
A nurse. A managing director.
No.
I'm running out. You said a lot of no's.
Stop badgering me. I don't want your suggestion. Thank you very much.
73-year-old Wendy is in A&E after falling at home and suffering an open fracture to her ankle.
Sorry to wake you. So we're going to start doing your ankle. So what you need to do is take a deep breath on this, okay? It's going to help with the pain. You don't look too impressed.
Doctors must stabilize her injury whilst they await her full scan results.
Yeah, you have it. And then breathe out. That's it, you're getting it.
Have you ever been married, Wendy?
Twice. First one was a disaster. I was 23 and he was a few months younger. His name was Keith. He liked to be called Dave.
All right, I'm going to give you some different pain relief in here as well. Keep going on the gas, lovey.
Anything else you want me to do with the foot or something? Everything was fine. Until Symph the nymph came on the scene. I didn't know they were messing about until Valerie told me, my neighbour.
Keep going on the gas, lovey.
I divorced him. I thought, I'm not having this. No way, you know, I'm not going to be second best. Be high as a kite.
You will be high as a kite. That's how we want you.
She's so funny. I love her.
Nasty one. So this is actually like a lower tibial spiral fracture.
Doctors have received Wendy's X-ray results, which reveal a serious break in her right leg.
We can't fix it now, so then we just put her in a back slap, get some X-rays, then get a CT and plan proper surgery. Hi, Wendy. I'm going to make you more comfortable in one of those plastic arms. We're going to put a back slap for you, okay?
So you keep breathing on that and we're going to do your leg, okay?
Here we go, Wendy.
Go again, big one. Keep going. Below. Big deep breath, big deep breath. Above me. Go on. I know.
Sorry, my sweetheart.
Keep going, you're doing really well. We're nearly there.
Sorry, sweetheart.
Come up a little.
All right, we're going to put on the plaster now, okay? Big breath. He's trying to help you. It's going to make it better in the long term.
I love you.
She's still going on the gas. I love it. It's probably making her feel amazing.
"52-year-old Neil was brought to St George's after falling 10 feet onto concrete. Doctors have ruled out internal injuries, but have discovered a large tumour in his brain.
So, Neil, I've had a chat to the neurosurgeons about this tumour in the head. So what we're going to do, basically, is they want you just to be referred to the neurosurgery outpatients for follow-up.
Can't be Milford, obviously, yeah.
Exactly, yeah. When you go home, we'll give you a discharge letter saying what we found. But in the meantime, we'll probably just keep an eye on you here overnight. Sorry to give you that scary news.
Oh, no, it's picked up. Well, knowledge is power.
I've got you a cup of tea. What do you take in it?
2 sugars, milk, please.
2 sugars and milk. OK.
It's not a blessing, but you know, you eventually come to the conclusion, well, yeah, this is better than not knowing. Knowing is better than not knowing. But for an accident, I'd never have known. We would not know now that I had a tumour in my head the way I feel. I can count myself lucky in some respects. The tumour looks quite a considerable size. Maybe the size of a hand, possibly, all the way around.
There we go, put one arm through there.
I've been told the tumour wouldn't, well, it's not going to stop growing. It'll just get bigger and it'll expand and it'll start to put pressure on my brain. It would be life-threatening if I left alone. I lost my father when I was very young. I was devastated. And being the youngest in the family at the time, you know, there's an effect on you, that. So I know the effect it can have on children. Yeah, and I'm well aware of that. And that's why, in a lot of respects, you just don't want that to happen.
Still in a lot of pain, darling. It's not helped at all, no?
Doctors are investigating the cause of Ben's ongoing pain after he underwent a shoulder relocation.
So he's back from X-ray, but he says he's still in agony, which to me makes me think it's not in.
It was in, and this has come out. Oh no, it so went in. Yeah, that shoulder is out. It definitely went in, and I think it popped out again.
Yeah, he's out, isn't he?
Hi, Ben. So, it's back out. It's dislocated. So I think your ligaments are probably very stretched or completely torn. The orthopaedic doctors want us to reduce it down here again.
I'm gonna step out, let them do their thing, okay? I love you very much.
Yeah, sure. 5 mils per hour to start off with.
So I'm not going to do anything sudden, okay? Just nice and relaxed. Just go all floppy. Hold on, give me some space. That's it, that's it.
I heard it.
It's definitely in check, yeah? Because that's what I felt last time.
Seems quite stable.
I'm paranoid that it's going to come out again now.
So we'll hold him there. Okay, all the way around. First.
Right, Ben. Does it feel better? The pain?
Yeah, it does. Yeah.
Good job. Yeah, this is a bit sexy.
Yeah.
Huh?
Happy? We just need to re-examine you. Can you feel me touching your hair?
Yeah.
Can you feel me touching your hair? Yeah. Here and here. Give me the OK sign. That's good. All right, but you can go home. No worries.
Thank you.
Oh, so much better.
Good. We've talked about would either of us want to get married. I think his parents being divorced, my parents being divorced. I think we're both at the same conclusion at the moment that we're not sure. Right here, okay? Just close your eyes. I guess experiences with my family have shown just how devastating the breakup of a relationship can be. And that's something that I don't want ever to happen to me. I became hugely guarded after my mum and dad divorced. Didn't want to get married, didn't want to go through that hurt. No, I can do it if you want.
Thank you.
Meeting Ben has changed my mind. He's a good man. Men can be good. I don't know how we're going to dress you. I'd like to think that we would always be there for each other. He's always been there for me, and I plan to do the same for him. People are going to think you're a runaway. We tell each other that we're a team. I know that I've got him, and he knows he's got me. What a day.
Certainly in our research, we see fantastic relationships. The way they come together, the way they support each other.
Thank you.
I'm not married and I'm not in a relationship. I made huge mistakes early on in my life, subsequent to which I have not been in a position to have a partner or want to take on a partner, I suppose. If I speak to my friends, they think I'm the luckiest man on earth. I am independent, I've got the whole bed to myself. But there are lots of times when you're lonely, and there's lots of times when you wish you had a confidant, someone you can talk to, someone who can support you, someone who can be with. But I'm kind of a realist verging on a pessimist, so not quite sure if that's going to happen.
Here you go, sweetheart. And some water there for you.
Oh,
you enjoy that.
73-year-old Wendy came into A&E with a severe open fracture. Doctors have stabilized the injury and are preparing her for surgery.
I never thought I'd say the water was lovely.
You have to change the full champagne when your leg's fixed.
Champagne, what's that?
Maybe just a pint then. Gin and tonic? Cup of tea? There we go.
Can you tell me about your second husband, Wendy?
A very gentle, kind, loving man. There's nothing more I can say about him. He was lovely. I loved him to bits. Still do. Never been another man in my life since. I'm a one-man person, apart from one divorce.
We'll be getting you up to the wards very shortly.
I met him at a holiday club that I was working at. He played the fruit machine, which was right near the bar. And he asked me for change, which I gave him. And that was it. That was how we met. And we used to go out, have meals, and we weren't clubbers, night clubbers or anything like that.
Hello, Wendy. How are you? Wendy? How's the feeling here now? Can you feel me touch you there? Can't feel me touch you there? No? What about here? Definitely you can't feel this. No?
If you can't feel your toes in a severe ankle fracture, it means that the nerves to the toes have been damaged.
No? No? Not even a tiny bit?
The best case scenario, the nerves have just been bruised and over weeks and months they will recover. If the nerves have been completely cut and there's a gap, then the chances of recovery are poor. Your mobility is that much more affected. So that's going to have repercussions on your quality of life from then on.
I need to tell you about your surgery. You've got a bad wound there on your leg. So you're going to have to temporarily fix that. So you'll have something like an antenna sticking out from your leg, okay?
We didn't get married until about 4 or 5 years later after we'd met. But now, this year I would have been married 40 years. So it would have been my ruby wedding this year. But he's not here, so it won't be. He died in a home in New Malden. He was there for about 5 or 6 years. And I was driving then. I used to go see him every day. And he died there. The doctor said that it was old age and pneumonia. Can't argue with it, can you? And that was it. 3 years ago this month. But there you are. That's the way life is.
Ready for the X-ray?
Whatever you say.
Here you go, let me take off all of these wires.
Oh.
Get you looking a bit more human again, eh?
I still talk to him at night. Good night, Bill. I'll be up there with you soon. I bet he thinks so, I hope not.
Karen has met my parents now. Yeah, her having to call each of them the day of the accident showed me that it was about time. Living together has been really good for us, and I think it's just emphasised how good we are for each other and how great everything's going.
I got letters from them about osteoporosis. They needn't think I'm going there for that. No way. I told them I'm not interested, and that was it. Not heard from them since.
Not many families will go through what we're going through now. The kids just were totally devastated. I think they've probably realised for the first time how fragile and precious life is and can be.
I just remember getting, "Can you wake up now, Neil?" I automatically opened my eyes and I looked around and there's lots of people around me. And I knew exactly where I was, and it was just an amazing experience. An amazing experience. The surgeon, he's very confident that he's got it all out. So, onwards and upwards, we hope. I first saw the children the next day. It was great to see them. I just count my blessings. Day by day, I'm just getting stronger and stronger. I think this time next year I might be running the London Marathon, the way I feel at the minute. I realise that I've been given a second chance.
Doctor, I can't feel my legs. That's because you don't have any arms.
Any St George's?
With his friend with a loaded air rifle was shot at him.
Adult priority call, ETA 15 minutes. Central Ear male, his ICD has fired 11 times.
I always knew that there was a chance that he could die, because if the heart fails, the heart fails. So this could be the end.
Help!